and welcome back to the channel. My name's Ash. I'm a doctor and a dentist in the UK, and you've not probably seen me do a video like this in a while because I've just spent the last few months filming a very long course for interviews. That is about 15 hours of video footage, but what I'm going to try and do with this is condense it down into a very short, bare bones series where I teach you everything that you need to know and the essentials for your medical school interview. So I'm going to take all the 13 modules that I teach on my course and try and condense them into 13 short little summaries of each module, just to give you the key essentials that you can take away. Because we're in peak interview season at the moment, I'm going to be releasing these quite quickly, so every 2 or 3 days. So to make sure that you don't miss any, hit subscribe in the bottom corner and make sure that you turn on notifications to be alerted whenever they come out. Also, if you wanted to check out the full course or see where you can book a one-on-one mock interview with me, just have a look in the video description and you can find the link there. So let's kick off this series with a summary of my introductory module that looks at all the things that we need to know generally to succeed at interview. So firstly, let's look at why. Why do we interview? The Medical Schools Council recommends that every medical school interviews its prospective students. And there are 3 reasons for this. 3 main reasons are that first, you understand the career. Second, do you have the right skills to be a doctor in the first place? And then the final one is to verify that you are who you say you are on your personal statement. The first bits that we look at in the introductory module is appearance. Now, this interview is your first interaction with the medical school that you're hoping to potentially go to and study at. And therefore, it's important to dress the part because it's your only chance to make a good impression with these people. I know this is stating the obvious, but some of the things that you need to make sure you do when you turn up to interview are: make sure you turn up on time, make sure your clothes are ironed and washed and clean. If you're turning up in person, make sure your shoes are clean and polished, and make sure just all of the basic things are taken care of, like you've showered the morning of the interview, your fingernails are trimmed and clean, and also that you've brushed your hair, and things like not smelling too strongly of perfume or aftershave. Medics are generally a pretty conservative bunch of people, so whether you agree with it or not, it's just in your best interest to make sure that you dress conservatively when you turn up to interview. And that might sound boring, but essentially there's no point risking it with some outlandish clothes. So dress very sensibly, dress very sober, and stick to the rules that I'm about to recommend. So for guys, I'd recommend wearing a suit, shirt and tie, or if you don't have one, you can wear your school uniform. And men should avoid earrings, white socks, or even loud shirts, ties and socks, especially when on screen because they show up more than they would do in real life. And then for women, you want to think professional attire. So this can either be a smart dress or a button shirt or blouse, or a skirt or some trousers. And again, you can also wear your school uniform if you'd like to. And for women, I would generally say avoid low-cut dresses, short skirts, or excessively large hoop earrings. If you're struggling to decide what to wear, just think of a time when you've been to see your GP and the kind of thing that they wore, and think along those lines. Ultimately, you need to think, what does what I'm wearing say about me and what impression does it give off? Next thing we talk about is making a good first impression. Now, for better or for worse, your impression will set the tone for the interview, and if you can put people at ease and give a good impression of yourself from the start, it will automatically just make the whole thing go a lot more smoothly. And your first impression essentially comprises 3 things. It's how you enter the room or the scenario, say if you're doing an online interview, then also how you greet the panel or the person at the other end, and finally your body language or how you sit. It's understandable that you'll be nervous, and the panel do expect that, but try and at least maintain some level of calm, and there are lots of techniques that we teach on how you can do that on interview day. Remember, in medicine, you need to demonstrate your ability to stay calm under pressure, and this is no exception. The best things that you can do to help put everybody at ease is smile. It will put you at ease as well as the rest of the panel. So on the virtual type interviews, you need to look directly down the barrel of the lens of your webcam just to make it feel like you're making eye contact with them, and give them a nice big smile. And if you're doing it in real life, then make sure that you look at everybody in the panel and give them a great big beaming smile to let them know that you are the kind of person that would make a great doctor. Some quick points on the best way to sit. So I would recommend that you sit legs uncrossed, Feet square on the floor, sat upright, shoulders back, leant slightly forward to show that you're engaged. Then either cup your hands in your lap or just place your hands on your lap to stop from fidgeting. If you are someone who's prone to fidgeting, you can take something like your record of achievement and just hold on to it and put it in your lap so that it stops you from messing around with your hands and distracting the interviewers. 3 sitting positions that you should really aim to avoid during your interview are either being slouched, being sat back cross-legged, or sitting on your hands. They all give off the wrong impression and not the kind of thing you're trying to get across when you're trying to convince someone that you want to be a doctor. And one of the best tips that I can give for all of your interview practice is to record yourself. Practice on the platform, have a practice buddy that you're going to use the same sort of platforms that you'll use for your actual interview on, and then record each other, and then watch it back and see how you come across. There is nothing that will paint the picture more clearly than a cold, harsh reality of a recording that shows you exactly all the things that you're doing right and wrong. The final thing that we teach in our introductory module is how to structure your answers. It's really important that your answers appear structured, coherent, and systematic. So I'm going to go through my general points to ensure that you do that when delivering your answers. First is to just make sure that you're clear, concise, and to the point. Don't give long, waffling answers that aren't useful or getting you any marks. Second is always use interesting examples that are unique to you and true from your own life. They bring any answer or any story that you're trying to tell to life and make it a lot more interesting for the interviewer. And probably the most important thing is that at the end of every answer, you always need to reflect on it and link it back to why it would make you a good doctor. So whether it's a story that you're telling or a lesson that you've learned or just something that you're going to apply that's going to help you with your journey through medical school or your career in medicine at large, just make sure you always link it back to that. So here's some of my most important advice for answering these questions at interview. The first one is, like I say, be clear, concise, and to the point. Give short answers where appropriate, or where they ask you to elaborate, give a concise story. The second is to really think about what they're asking you. This might seem like a read the question type bit of advice, but often people mistake familiarity for understanding, that you think that you know what they're asking you and they have asked you something that you recognize it to be similar to some of the typical interview questions that come up, when actually when you really listen they're asking for something else. And I see it all the time when people go off on tangents thinking that they've been asked a common question from interview where actually it was phrased in a way that makes the context different, and they're just going off on a complete tangent and wrecking their chances of scoring highly. And my other tips are, use true and interesting examples, describe them with strong definitive words rather than fluffy explanations, and then finally have a structure for how you answer these questions. And before we wrap up, I'll quickly give you my structure as to how to go about answering these. So this is something I use called the SCARE tactic. So S-C-A-R-E. The S stands for scene. So explain the scene, explain what was going on. Then C is for challenge, explain the challenge that you faced. A is for the action that you took. R is for the result that that action created, and then E is your evaluation, where you reflect on what happened and again always link it back to why it would help you or make you a good doctor. Just before we wrap up, I'll give you some of the most annoying pet peeves from interviewers. These are the most common ones, and definitely when I interview students, the ones that annoy me the most. So the first one is lying or being hyperbolic. We have a good BS detector and we can really tell when you are putting it on. So don't back yourself into a trap, because when people smell blood, they will really go for you. So just stay safe by telling the truth and telling things as they are without exaggerating or being hyperbolic. The other pet peeves are things like arrogance, cliche examples, failing to answer the question, and finally answers that lack life or passion. And as I say, my final bit of advice is to make sure you film yourself, watch it back so you can pick up on all the little idiosyncrasies that you have. You can even watch yourself back on mute to really just get a good flavor of what your body language looks like when you're not actually speaking. So there you have it. That's a very bare bones summary of the first module of my online course, where we just give you some general tips as to how to present yourself, how to present your answers, and how to structure them when you're giving them an interview. As I said, I'm going to be releasing a lot of these videos quick fire over the next 2 or 3 days each, so make sure that you subscribe and hit notifications so that you don't miss them. If you want to have a look at the course in full, we have over 15 hours of online videos. We've got lots of videos of real students doing mock interviews, and I dissect exactly what's wrong about their answers and what could be improved, and then show you videos of how they've improved. Also, if you wanted to do a mock interview with me, I've linked to all of that in the description below, and I'd love to have you if you wanted to join us on any of the courses or some mock interviews one-on-one with me. So thanks for watching, and I'll see you in the next module.